My name is Alicia, and my pronouns are she and her, and I live in Ohio, and I have a physical and developmental disability, and I'm an advocate for myself and others. So I use a waiver through the Ohio Department of Developmental Disabilities. I'm on the IO waiver, and I use agency providers. I wanted to say too that I've been on the Medicaid waiver, and now I have a DD waiver, so I know both sides of what it's like with care and the care crisis. So when I have all the care that I need, I'm happy and I'm thriving, and I'm really being able to be in my community with others. And some of the things that my caregivers help me with are different activities of daily living, such as bathing and dressing and things around my home, but also they help me in my community and help me with employment goals and just being able to participate like any other Ohioan in the community, going to the art museum and other places that I enjoy. So I've been impacted by the care crisis in many ways. First, I was on a Medicaid waiver by the My Care Ohio waiver, and I had significant challenges recruiting workers. At $12.96 an hour, I couldn't recruit anyone. Plus, my managed care plan took many months to contract workers. I had one provider that I was trying to contract for 17 months. There's really no transparency in Ohio with around the care crisis and credentialing of workers, and so that was problematic. I was on a 200-day backup plan and went through an awful lot of abuse and harm because of the care crisis, and I actually finally got a waiver through the County Board of Developmental Disabilities after many months and fighting and everything, because it came down to the point that I was in a dangerous situation as a result of the care crisis. And so I got a waiver through the County Board of Developmental Disabilities, and I found that even with that, just many agencies were understaffed, and so some of them were combating their staffing issues by working workers 72 to 96 hours on my case, and with no breaks and no sleep, and they were violating labor laws, but it was causing me to be subjected to abuse and harm as well on the DD side. So it's been a really long road for me, and there's been significant challenges finding care, recruiting providers because of the low wages, but also too, there's a lot of red tape in Ohio's healthcare system. But to survive all this, I've painted about 25 feet of art, interviewing people across the state, and involve myself in peer support and advocacy, and I just keep going because I'm trying to raise awareness, but also keep talking about this, hold these conversations because it's important, and also helping people visualize the crisis. And that's all. So I think that the wages should be increased for home care workers. I also believe there should be transparency with pay for providers and the managed care credentialing and contracting, because some of us, we have found providers, but when we can't get them paid by the managed care companies or by the different systems that serve us, then that doesn't allow for the people to stay in the field very long. I also think that we should be utilizing our underutilized job centers. There's so much resource there where people can get training as home care workers, get their first aid, CPR, background check, and get the training they need. I think that so much money is wasted every year on job centers that go underutilized, and they were meant to be one-stop shops. So why don't we do this with our job centers by creating training centers for them, and making it so that in each county there could be a pathway that is easy to become a provider, because that is something that is not easy in Ohio. There's a lot of red tape to become a provider, And so just but mainly we have to raise the wages, but also we have to work at opportunities to recruit people as well.